Kisii Eye Hospital was officially inaugurated by Kisii County Governor, His Excellency Honorable James Ongwae on 29 November 2013. Since its inception, the hospital has grown from its humble beginning, hence becoming an outstanding specialty private eye hospital in southwestern Kenya, and it's committed to eliminating preventable blindness. This initiative is led by Dr. Kiage, who is a consultant ophthalmologist and a glaucoma specialist in collaboration with other national and international eye care providers.
My name is Dr. Kiage. I'm the founder and medical director for Innovation Eye Center's Kisii Eye Hospital. I'm a consultant ophthalmologist, that is an eye specialist and an eye surgeon. And I'm also a glaucoma specialist. I did my glaucoma fellowship in the University of Ottawa in Canada.
The hospital is found in the heart of Kisii land, Kisii County in southwestern Kenya. It's located in a good, quiet environment, far from sound pollution in town at a place called Nyanchua.
My name is Kiage. I'm co-founder and the Chief Operations Officer, Innovation Eye Center. We also call ourselves Kisii Eye Hospital. We're the first subspecialty hospital in southwestern Kenya, and we are located in Kisii. The reason why we started the Innovation Eye Center is because we saw a need to solve the social problem of blindness and visual impairment. We did have many organizations offering these services, especially in the county of Kisii and Nyamira. So Dr. Kiage and myself came from Nairobi to come and establish this hospital here.
The hospital operates as a social enterprise that offers high quality, affordable and accessible comprehensive world-class eye care services to the community in southwestern region of Kenya and beyond. We aim to create positive social impact on unmet needs in eye care through the restoration of sight and prevention of avoidable blindness. As we combine business discipline, medical skills and compassion, we will ensure that all can receive high-quality, affordable eye care services irrespective of their socio-economic status.
What we hope to create really is more of a social impact. That means to impact the greater community so that we can improve livelihoods. For example, cataract surgery can take a few minutes, but the impact is very enormous, I could say, for the individual, because they can see, so that improves their eye health. And it means that they also improve the education, because we find that most of the time children stop going to school to look after the old people. So when the old people have been done for surgery, you get that the children are able to go to school. So that means that more children will get education and therefore also improve in their lives and stop the poverty cycle that is surrounded around the blindness. And the person who has gained this sight is able to go back to their work and be able to work. For example, we find that the old ladies who come here, they tell us that they are now able to till their farms, get their vegetables, can go and sell things in the market. And that means that we are really causing an impact in the community.
The hospital set aside a section of administration that assists in directing the operations of the hospital. They have responsibility for facilities, services, programs, staff, budgets, relations with other organizations, and other management functions.
My name is Geoffrey Kerimonderi. I'm the Business Development Manager at Innovation Eye Center. I work under the Administration Office. In the Administration Office, we do so many activities. That's from accounts, human resource, procurement, data quality, statistics, and logistics. We also coordinate all other departments, that's the optical department, outreach, housekeeping, and the medical records. We try to make these departments work in harmony by providing them all the consumables and all the support they need in order so that we can achieve the organizational goal and objectives.
Kisii Eye Hospital provides high-quality, comprehensive eye care services, and it's well equipped with the latest state-of-art equipment for the diagnosis and treatment of diseases.
In terms of the machines, we have specific machines which strictly deals with the eyes. And in this case, we have two categories. We have those machines which we use for investigations, and we have the machines which are used for treatment. For example, for investigations, we have one machine called amplification field.
It is used to detect any signs of glaucoma damage to the optic nerve. It measures an entire individual's scope of vision.
And we have another one which is called OCT, it means optical coherence tomography. It takes details 3D image below the surface of the retina, giving more details picture of your eye health. It aids in diagnosis of eye diseases like glaucoma and diabetic retinopathy. Then we have another one which is called pachymetry. Pachymetry is used to measure the corneal thickness of the eye. Then we have the machines which are used for treatment. We have lasers, and in this case, this is laser SLT. For this, it is used for patients who have glaucoma. It is basically used to lower intraocular pressure. We have another machine called Kiage laser. This is basically used to treat patients possibly after cataract surgery. We have another machine here called argon laser. Argon laser is used to treat specifically diabetic retinopathy and some cases of glaucoma.
We offer the state-of-art treatment and surgical facilities, supported by highly qualified specialized ophthalmic personnel that includes consultant ophthalmologists, optometrists, refractionists, ophthalmic nursing personnel, among others. We also have a well-equipped theater fitted with operating microscopes, ophthalmic operating tables and chairs, phacoemulsification machines, and eye surgical instruments, among others. Our theater is attached with recovery rooms, and comprehensive infection control guidelines have been put in place. All procedures at our hospital are backed with a team of well-trained nurses. Our target is to cover a population of about 5.2 million people, especially in the counties of Kisii, Nyamira, Migori, Homa Bay, parts of Kisumu, Narok, and beyond. The cross-subsidization model ensures that services are available at normal rates to the people who can afford and substantially below cost to the most vulnerable and low-income members of our society. This is done through our private clinic, general clinic, and community outreach eye camps.
In private way, this is a place where we see patients who normally use insurance schemes and patients who have been referred from different hospitals to see specific doctor. For example, in this private clinic is where Dr. Kiage is seen, and most of them they are referred to see him.
We want to serve everyone, irrespective of their socio-economic needs. So it doesn't matter whether you are an IN patient who comes to the private clinic and has insurance, or whether you have little money. We have a general clinic which we call the subsidy clinic, where you can also be served.
Community outreach program is an integral part of our services at Kisii Eye Hospital that takes eye care services to the community. These services include comprehensive eye screening camps, mobile refraction camps, children's screening camps in schools, diabetic retinopathy camps, and workplace screening camps.
We also go out for outreaches to try to reach patients who are not able to come to the hospital. That will allow them to know the hospital, and also we can handle their problems at their place. Most of the time when we go out, we try to see as many as possible, and we also try to identify especially patients who need surgeries, so we can bring them for surgeries. We also treat conditions we found with them. Those who need more specialized investigations and treatment, we advise them to come to the hospital.
Nabwate shida ya maiso abanyagitari bampimire banyore nimbwate shida yo korora go bana bansugurikire bangeire birora baki banyore tabiye bunanje nabere ngo cyane kamatuka amange kwerekera nasomire gusinkurika gusine message gonkorore gesunte narra abantu kucyari ngo gikorire nabantu kino uri nyarebera kimyonsi nyabona tini komorrakie ni ngana kyari narore gesunte pi tini korra no
Maisha tinggal betul. Nah, tinggal lagi tinggal itu. Betul tinggal. Coba itu tinggal. Ada kita lah. Ya, bulan ini.
Atendo tinggal bahagia loh. Tokonya biji mana? Bawa nanti tokonya menambah katakan terpunya ramah. Nako nyari juga sih kau mau kerja tak?
We have an optical center where our patients can get spectacles at a good price. We stock both high quality, durable low-cost glasses as well as a designer frames for our patients. We do not just sell eyeglasses. We examine the eye first to rule out any other disease before we advise for glasses.
Our department, the optical department, caters specifically in giving spectacles to patients. Patients from the outpatient clinic, that is the subsidy clinic, and the private clinic are referred to our department while undergoing examination. So we perform one of our major examination procedures called refraction within the department. After refraction, the patients are referred back to the ophthalmologist for further examination. If the ophthalmologist sees it is important or it is necessary for the patient to have the spectacles, he writes the prescription and sends the patient back to the optical department or to our department to get the spectacles. Once we receive the prescription from the ophthalmologist, We go through it and see and discuss the best lens prescription for the patient. In this case, we do what we call dispensing by selecting the best lens and the one which will make the patient to be comfortable. After that, we need all the patient is required to select a frame where the lenses are going to be fitted. We have some lenses which are in stock or which we can be able to get within the hospital stores. We get the lenses, cut them and fit them, and the patient might take them immediately. Also, if the lenses are not available, we make orders. Most of our orders takes 1 day to process, so we make an order online. Within a day, they will be delivered. There are some prescriptions which might take even to 1 week when they require overseas orders. So spectacles can be either delivered immediately or within 1 week after the order has been placed. So when spectacles are ready for correction, the patient is given a notification through an SMS or a call to collect the spectacles. Our spectacles are of different ranges which can be able to cater for all patients whom we receive in the hospital. We have low-cost spectacles and we have premium cost spectacles which caters for our premium patients. So our hospital being a social enterprise model, we cater for everybody in the society so that we can be able to eliminate preventable blindness within our Kisii County,